I would love to have the foreign one, but I can't even afford regular dentures. I am in constant pain. I have an abscess right now that won't go away. I've been on antibiotics 3 weeks. Almost all my top teeth are broken down to the gum, and my bottom ones are doing the same. The medication I have to have has destroyed them. I can't eat without pain. I don't smile. I am 50, single, and live paycheck to paycheck. I have no insurance, no credit. If dental care is something that is important, why is it so out of reach for people like me? I have no doubt that unless I get this fixed, it will somehow kill me, but there is no hope. I'm sorry, every time I see one of these ads that states affordable options for everyone, I get so upset because it's not for everyone. Lenders won't touch me, Care Credit won't, there's nothing for me. Please stop saying there's something for everyone when you know that's not true.
Okay. Sounds like this person, Carol, she already has been, she's aware of the condition that she has. Um, I'm not sure of her medical condition, and I'm not sure of her insurance status and all of that. Not that sometimes we are not able to help patients. For example, patients who walk into my office, I'm not the doctor for every single patient that comes into my office. We have some patients that have special medical conditions. We have to refer them out because we more than helping the patient. Of course, we want to be able to help the patient. I'm more concerned about their safety.
Mm-hmm.
You know that. How
Right.
many patients that we refer out to UT Southwestern?
Mm-hmm.
We have a lot of patients that we have medical conditions. They need to be treated in a special facility to be able to get those procedures then safe enough. So
Mm-hmm.
for those patients, we have to refer those patients out to the facilities. So I'm not sure again of the medical conditions you may have, whether that is kind of hindering the doctors to be able to help you. Going back to the question that you asked about the finance, I wish I could help a lot of patients out with almost either no payment
Mm-hmm.
or with the affordable payment options. We are here to help us many of our patients with the affordable payment options, but depending on the budget, if we're able to work something out. If you're not able to, if you feel like you have a Medicare or like Medicaid, then and just talk to your providers, either your Medicare or Medicaid providers, and then see whether they can send you to a facility that they are able to provide care under your plan. And I tell my patients, hey, don't say that you cannot afford for the treatment. Just start thinking, how can you afford for the treatment? Can you save $25? Can you cut down on a meal
Mm-hmm.
to save $25? And then can you go down to Baylor to get a tooth extracted for $25? Absolutely. So I have information that we have some people that we have work with in Baylor. They are doing extractions as low as about $25-50, and so you're able to go to those clinics if you think the private clinics are not the best options for you. So yes, there are options for most of the people, but some people, our hands are tied as far as what we could do to help. And I wish I could help every single patient. But feel free to just send an email or give us a call. We'll be happy to refer you to somebody who may be able to help you. Or again, like I said earlier, talk to your provider, either Medicaid or Medicare or whatever the insurance provider that you may have. Ask them whether they can refer you to a facility who may be able to help you under your plan. Really.
All right.